In Module 2, I will be focusing more on reducing no-shows in your office. Some of the topics that I will be covering in this module are phone policies, retention, and I will also be reviewing some strategies to help you reduce no-shows in your office. The first thing that I want to go over is our phone policy, and this is a policy that we teach all of our managers to follow. Having proper phone etiquette is very important. Phones must be answered right away. Your tone of voice must sound confident and clear. Always introduce yourself and the name of the company. And you should always sound lively and happy, even if you're not having a good day. So when putting someone on hold, I like to teach some of these rules. The first one is always before putting a patient on hold, let them know that you're going to put them on hold. And always wait for them to respond. That way they don't sound like you're being rushed off the phone and it doesn't come off as being rude. Make sure you do not leave someone on hold for an excessive amount of time. If they are on hold for an excessive amount of time, maybe they are waiting for someone else, maybe you are trying to help them solve a problem, follow up with them. Let them know that they have not been forgotten. And before hanging up, always ask, is there anything else that I can help you with? Retention. Now, retention is a word that, especially in the world of physical therapy, you will be hearing a lot. As a manager, it is your goal to make sure that your patients are coming to therapy when they're supposed to. So always call patients the day before. Call patients to reschedule as soon as they miss their appointment. Don't wait until next week. Don't wait until the next day. You want to call them and reschedule as soon as they miss their appointment. That way you don't forget about them. That way they don't just disappear. And you can, keep that retention going. Explain to the patient what the process of their treatment is on the first day. The more they understand what your treatment consists of, the more likely the patient will continue coming into your office. Always remind them how important their therapy is, and make sure that there is a good patient-therapist relationship. Make sure your therapist create this special bond with your patient, that they, that whole reminding them of how important the therapy is. That's when the therapist can really play their role and make sure that their patients keep coming back. So here I just listed some strategies that I will be further expanding on reducing no-shows. The first one is know the warning sign, train your patients to keep a positive attitude, train your front desk into the no-show reduction department, adapt your scheduling to your patient needs, enhance patient compliance with the care plan, keep the appointment in front of the patient, give them something that jumps out of them, and always automate everything. And luckily TheraOffice allows for us to automate a lot of things, and I will further explain how that will work. First thing you want to know is what causes a no-show. It's very important for you to know the causes of a no-show so that you can later address them. The first one is forgetfulness. Some patients will forget their appointments most of the times. And as most patients that do forget their appointments is because maybe therapy is not a high priority in their life. So they forget about it. They kind of put in their back of their mind. That's when your role comes of making sure they don't forget. A lot of patients are afraid to come to therapy. Maybe they're in so much pain that they're afraid to come to therapy, or maybe they experienced a lot of pain the first time they came to therapy, so they might be a little bit scared to come in to your office. Finances is a big thing. A lot of patients, even a copayment can be a burden to them. So it's important for you to keep that in mind, that some patients cannot afford to come into therapy. Maybe they can afford 1 time a week, but they can't afford 3 times a week. So you have to keep that in mind. Frustration. Some patients feel like they're not getting any better, so they might get frustrated and just stop coming in. A bad experience. Maybe the patient had a bad experience the first day they came in. Maybe the front desk wasn't very nice. Maybe they didn't like the therapist. And embarrassment. Some patients are embarrassed to come into therapy. One of the reasons could be maybe they were given a home exercise program that they did not complete, and now they're embarrassed to come in. In essence, it's almost like they didn't do their homework. So it's important for you to find out why the patient is missing their appointment. And it's very easy, you just ask them, but this can be a little bit tricky. Every time the patient misses an appointment, the front desk should call to reschedule the patient and to ask the patient why they missed their appointment. So you have to know how to ask that. Some patients might take that as you're asking them a personal question, but in reality, the reason why you want to know why they're missing their appointment is so that maybe you can help them. Maybe they're not coming into therapy because they don't have transportation. Maybe they don't have enough money to pay for their therapy. Maybe they don't like the therapist. So whatever the reason is, you can try to help them. Maybe call an Uber for them. Maybe you can, set up some kind of payment plan. Whatever it is that you can do it, but the only way that you'll be able to help your patients come into therapy is by asking them why they're missing in the first place. So it's easy, just ask them, but this can be tricky. So it's something definitely that you want to practice. Always correct patient misconceptions from the first moment you hear them. A lot of patients think that just because they don't have any more pain, that means that there isn't a problem, they don't have to come back to therapy, which is not true. So, a lot of the times, patients might come into therapy a couple times and feel a little better, but it doesn't mean that the problem is still not there. They might feel good for a couple days and then all of a sudden their pain returns. So you want to make sure that patients understand that just because they're feeling a little better, it doesn't mean that they should just stop coming in. Patients think that they're being generous by missing their treatments and giving their therapists a break. So that's one misconception there that you want to fix right away. That's when the therapist can do do the role of like making their patients understand that they have to come into therapy, that they want their patients to come into therapy. That is very important. And the way that you can do this is by having conversations with the patients. Set high expectations for the patients and repeat those expectations consistently. The more they hear it, the more it'll be engraved into their brains, and the more likely they're going to keep coming back. The front desk. The front desk is very important. This is where the patient gets the first impression of your practice. So on arrival, the patient should be checked in and should be checked in correctly. This will help you get accurate reports later when you print them out from your system. Ask how the patient is doing and never be clinical. It's not the front desk job to give the patient any advice on what kind of therapy to do, what kind of medications to take. These conversations have more to do with either their case or what appointments they have. They can even be personal conversations, because in essence these are patients that you'll be seeing multiple times a week. So a lot of the times you're going to learn a lot about these patients, about their family, their kids, their grandkids, what kind of sports they like, their dog. So most of these conversations are going to be a little bit more personal, which is fine. If patient cancels or no-shows, call the patient to get the reason and reschedule right away. And try to make it a habit that your patient, every time after they're done with their treatment, that they check out at the front desk, so that you take this opportunity to see how they're doing, remind them about their next appointment, make sure they have an appointment. Sometimes patients will finish their treatment and just walk out, and then you didn't really get a chance to see if they needed an appointment, or if their next if they were going to come back, how they were feeling. So you want to make that a point, so that your patient always checks out first before they leave. Appointment reminders. So reminder cards, and they're used a lot in almost every office, and I personally use them myself as well. But they've been found to not be very effective, and the reason why they're not very effective is because they don't create much of an impact on the patient. They get lost very easily because they're small, and they can also lead to errors, like if the front desk writes the wrong appointment on the card. So, you can still use reminder cards, but know that you're going to have to back it up with something a little bit stronger. Instead of using reminder cards, you can use a full-page sheet with all the appointments on the paper, and their office will allow you to do that. So on the first day that they come in, you can do all their recurring appointments, and then you can print out the full-page sheet with all their appointments. And before they leave, you can go over the entire list, go point by point, make sure that you make eye contact, be engaged, and you want to be a cheerleader to these patients. You want them to know that we want them to get better. And these full page sheets are bigger. They create much bigger impact than the reminder cards do. They're less likely to get lost, and patients will more likely keep them in the car or keep them on the fridge. So it's definitely something that jumps out at them. Scheduling policies. So in the intake, there's a section where the patient can choose what kind of reminder they want, whether it's text, call, or email reminders. But you can also set that up when you schedule the patient into their office. There is a section where you can put what kind of reminders the patient will prefer. So the first thing you wanna incorporate is to limit wait time. So you want to get new patients in as quickly as possible. You can use that time when it's their first time in the office to show the patient around the office. Show them where the bathroom is, make some small talk, just kind of make them feel like they're at home, and that way you can create a positive first impression, and they'll keep coming back. So enhancing compliance in your office. This slide is more just to give you an idea, to kind of get your brain kind of thinking about what kinds of things you can do in your office to enhance patient compliance. You can be creative with it. So really what you want to do is that you want to put things into your reminders that make them understand more about their conditions, because the more they understand about their condition, the more likely they will attend their appointment. You can use emails to remind patients about their home exercise program. You can reward compliance, maybe do patient of the week reward. You can also recommend motivational articles, books, videos. You can send links through text reminder, through email. Everything is about keeping the patients engaged and keeping them focused on their goal of getting better. So the best thing for reminders, besides printing out a full page sheet of all their appointments through their office, has been found to be text messaging. And even older generations are starting to text. And most people do not even check their voicemails. Even though calling and emailing is extremely effective, that it's something you always want to do, sometimes leaving voicemails doesn't really work because most patients don't really listen to them. So text messaging is something that more people like to use. I've used it myself, where if somebody doesn't answer my phone calls and I'll use the text message method, then they will answer because they prefer text messaging over a phone call. Automate it. So thankfully with TheraOffice, we can automate a lot of things. It allows you to spend more time with patients. Everything is sent out automatically every day, and it's not that expensive. So with TheraOffice, you can set up a text or call reminder. It's a couple of cents per text and per call. And you can set it up with TheraOffice, and how it works is that when you schedule the patient, the system will automatically send a reminder the day before, whether it's through text or through a phone call, depending on what setting you put for that patient. And it practically pays for itself. With just 1 or 2 appointments that are saved, you're practically paying for the service. So what to say in a reminder message? So the typical things, you want to put the date, the time, their name. You can even include their procedure, and you can also include their address. But really what you want, so in a discipline like physical therapy, with patients coming in multiple times a week, the chances that they're actually forgetting are very slim. It has more to do with priority. So you don't want to make it easy for them to cancel. You want them to have to actually call you to cancel. There's some reminders where you can, press 1 to cancel, but you don't want to make it that easy. You want them to have to actually call you to cancel. That way, you can have that chance to ask them why they're canceling, and you can also have the opportunity to reschedule them for another appointment. And that is the end of Module 2.